Hi everyone, how are you? Good. Thank you so much for attending the lecture. This is Dr. Nazmul Huda from the School of Population Health, University of New South Wales. Today I'll be delivering a short lecture on an introduction to global health. Before I begin, I would like to acknowledge the traditional owners and custodians of this land, specifically the Gadigal people on which I am speaking today. And this is the lecture outline. I'll be talking about global health definition, difference between global health, international health, and public health. I will also provide a short discussion on why global health is important and connection between global health and globalization. Finally, I'll be discussing the role of key actors in global health. So, what is global health? In plain language, global health deals with the health and well-being of all populations across the world. Broadly speaking, global health is an area for study, research, and practice that emphasizes transnational health issues. Remember the word transnational. Transnational health issues, determinants, and solutions. It emphasizes the improvement of health and well-being of all populations globally. It also provides a focus on achieving equity in health for all people across the world. The term global health has been derived from public health and international health. Therefore, sometimes it is difficult to distinguish between public health, international health, and global health. I think it's important to distinguish between these key terms global health, international health, and public health. Here, I have provided two key differences of these key terms. There are five differences in the Lancet study conducted by Koplan and colleague. I have provided the study link here in the notes. You can read it. The first difference is geographical reach. As you see here, global health actually focuses on the issues that directly and indirectly affect health that can go beyond national boundaries. That's very important word, that go beyond national boundaries. Whereas international health actually focuses on the issues of countries other than one's own, specifically those of low and middle income countries. And you know the what are the low and middle income countries, and there is a widely accepted definition of World Bank about low and middle income countries. And public health actually focuses on the issues that affect the health of the population of a particular community or country. And the second difference is access to health. The primary focus of global health is achieving health equity among nations for all people, whereas international health actually seeks to help people of other nations. Finally, the public health. Public health actually attempts to achieve health equity of a particular country, or health equity for people of a particular country or nation. Now, the question is why global health is important. There are many reasons of such importance of global health. Firstly, there is widespread inequalities in health among different sections of populations, including individuals with low socioeconomic status, migrants and refugees, sexual minorities, older populations, and many more. Let's take an example. For example, Australia has an excellent healthcare system with limited inequalities among these sections of populations, whereas there are many countries in India, in South Asia, for example, India, Bangladesh, Pakistan, as well as some African countries where inequalities among these populations are widespread. Secondly, there has been a shift in demographic and epidemiological trends. Such such change in demography as well as epidemiological trends actually has a significant impact in the distribution of diseases as well as healthcare system and society as a whole. Thirdly, the rising threats of deadly cross-border infectious diseases, including Ebola and COVID-19. And fourthly, there is a disparity in health systems ability and preparedness. And you know that this is particularly true for low middle income countries, where they have limited preparedness in terms of tackling such cross-border infectious diseases such as COVID-19. So all these factors actually reinforce the necessity to improve health of all populations worldwide, as well as reduce inequality and tackle the public health threats. Now I'll be talking about global health and globalization. There is a connection between these two key terms. To understand the connections, we need to know what is globalization. Probably you have heard of the word globalization. So, in simple language, globalization means interconnectedness or interdependence of countries in various areas, such as trade, information services, and goods, and so on. Such interdependence or interconnectedness can result in the spread of diseases. COVID-19 is an excellent example for such a spread of disease through globalization. You know that COVID-19 was first reported in Wuhan, China back in 2019. Then it was spread globally from China. The spread of health risks often linked to conquest. Smallpox and measles were introduced to the New World by European invaders in the 16th century. The same explorers took tobacco from Americas to Europe and beyond. This has led to premature disease and death across the world. This is how the rapid increase in travel and communication and economic interdependence can lead to the new level of globalization and spread of diseases. So there are many leading risk factors for such communicable and non-communicable diseases across the world. So I have actually included here 25 leading risk factors from a Lancet study. I have provided the reference at the reading section. You can have a look at that. But don't be anxious about the font size. That's very small. You can read it, the whole study from the link I have provided in the reading section. So the main risk factor are childhood, undernutrition, high blood pressure, smoking, and many more. You can have a look at that. So such communicable and non-communicable diseases and the risk factors across the world in many countries across the world actually underscore the necessity for undertaking some roles by the key actors. These key actors actually includes public health professionals, international organizations such as World Health Organizations, primary key maker role player, and the UNICEF and Gates Foundation, and many more. These actors actually can play a role in some key areas, including research and development, policy development and advocacy, and implementation of interventions. They can also provide education and awareness about these diseases. And finally, these actors have a role in terms of enhancing global collaboration. And that's the end of our lecture. So before concluding the lecture, I would like to summarize the issues that I have covered today. Basically, I have talked about global health, uh, definition of global health, and the difference between global health, international health, and public health, and why global health is important. And I mean, I have actually indicated 4 reasons for such importance of global health. I also talked about the connection between global health and globalization, and mentioned some risk factor from Lancet study. I have also highlighted the role of key actors in different dimensions of global health. Hope you have enjoyed my lecture. Here are the readings you can read. I have actually mentioned only 5 studies and books. There are many more readings in the rubric. You can read it. If you have any questions, please feel free to let me know. And thanks for your participation in the lecture and commitment to global health. Thank you all.